law in Florida. When Martin Hoffman saw this change from effective judge and general to non-functional individual back to now functional judge, he was astounded and he joined our team. What subsequently happened, we tried to get a congressional appropriation through Congress to fund a national study, and that was unsuccessful. In the midst of this, the Walter Reed scandal broke, and we had the only proposal at the time to treat. As a result, George Bush appropriated $300 million to study TBI and PTSD. I put an application in to do this with hyperbaric oxygen, and it was essentially turned down. The Air Force did the same, and they were told that theirs would be funded, not at the dose that they had wanted to get funded, which was the protocol we were using, but if they used a high-pressure wound protocol. Subsequently, the Air Force has been internally funded to use this wound protocol for chronic traumatic brain injury. By 2008, the RAND report came out showing that there were hundreds of thousands of brain-injured veterans affected by both TBI, PTSD, and/or depression, at least one or a combination of these three diagnoses. During 2008, Dr. William Duncan and Mr. Martin Hoffman, on behalf of the IHMA and on behalf of Americans, visited approximately 200 U.S. congressmen and senators' offices to try to get something done and get funding for a hyperbaric oxygen study on chronic traumatic brain injury that we would oversee. Unfortunately, those did not produce a congressional mandate, but what happened was there was so much controversy stirred up on Capitol Hill that the Navy Surgeon General invited me to give a presentation to him on August 14th, 2008. Unbeknownst to us, and surreptitiously, a letter was sent by the president of the UHMS to the Navy Surgeon General and other military officials 1 week before my presentation, pointing out that they were the gold standard in hyperbaric medicine and had expertise in this matter and should guide them by forming a steering committee. Now, this was an interesting letter since there had been no participation by any of these individuals in this matter, either recently or in the remote past or in the history of this organization. So unbeknownst to me, after my presentation happened on August 14th, and I asked the Navy Surgeon General for funding for the pilot trial I now had in front of LSU's IRB. I was promised that funding by the Navy Surgeon General. It has never materialized. I was then asked to please work with his group of doctors to put together a best way forward to investigate hyperbaric oxygen in chronic brain injury. Over the next 10 weeks to 3 months, I did so. And finally, a conference was convened called the DoD Consensus Conference on Hyperbaric Oxygen in Traumatic Brain Injury. It was held in Arlington, Virginia, December 5th and 6th. And at that meeting, I essentially presented 20 years of experience, my current data, and now the 5 individuals that I had treated at our expense in New Orleans. These were Army brain-injured men from Fort Rucker, a few individuals from Louisiana, and what was the first case I had treated in January of 2008. And unfortunately, I left that out. But what happened was my pledge to treat veterans was picked up by USA Today as a quote from Dr. Bill Duncan. And it was answered by a judge in Boston whose Marine son had been significantly brain injured and was now afflicted with PTSD, chronic residual of TBI, the post-concussion syndrome, and was struggling in his life due to his cognitive deficits, behavioral problems, and nightmares. I brought him to New Orleans and treated him. His case is now reported in Biomed Central's Biomed Central's Cases Journal. It's in the June 2009 issue, and you will see the brain scans on there and the story. What was surprising about it was that by the 25th hyperbaric treatment on this protocol, his PTSD was gone. Now, this was an individual with daily nightmares, sometimes so severe he'd find himself on the floor. And by his 25th treatment, he went out to the French Quarter Festival in New Orleans with 400,000 people on the streets and was completely comfortable. Simultaneously, or I should say subsequent to this, Dr. Eddie Zant began treating some U.S. airmen the following year and had the same results. Dr. Jim Wright, who referred them, reported a few of those cases in undersea and hyperbaric medicine in 2009. But to get back to our story and what happened, after that meeting and this presentation of all of my data and the details of how to do this, the point of my presentation was to obtain funding for the national trial that we had set up through the International Hyperbaric Medical Foundation. We had a national network of clinics and hospitals who agreed to be part of an IRB-approved protocol to treat veterans on my exact pilot trial protocol. We effectively were told that the DoD would proceed forward, and there was a possibility that our study would be funded. At the end of the meeting, the general in charge of it all, General Laurie Sutton, came up to us and said, the DoD plan, as a result of this conference, for a large multi-center study that would take 3 to 5 years was unacceptable. She knew we had a plan to do this in a very rapid sequence subsequent to my pilot trial and asked us if we would proceed with that. We then showed her the entire plan for this. That was December 6th, 2008. I was asked to be a part of the DoD process, and unfortunately it has never materialized. On December 24th, we received a phone call from Dr. Sutton, General Sutton, asking us to come to a special meeting in Washington and lay out a plan and budget to do this large study that I would be the PI of, and that would use the protocol that I had developed along with Dr. Neubauer before me. On January 8th, we went to Washington. We were then told that this study was going forward to submit the final budget proposal and plan. Within 4 days of coming home from that meeting, we were sent an email and told we needed to go our own way, that we should stay separate from the DoD due to undue bias and outside influence. All of the information that I had given to the DoD, however, apparently was not remembered. And in the ensuing weeks, I was called multiple times by the incoming president of the UHMS, and asked repetitively to put in writing everything that I had developed, my protocol, the information, the algorithm, the side effects, oxygen toxicity, so that I could be, quote, properly credited. Submit this to them, and they were then going to perform the study under the directorship of Dr. Lynn Weaver. Meanwhile, I have not been funded for anything. And in fact, this pilot trial continued on despite every obstruction by military medicine. As we have continued, though, with the pilot trial, I've accumulated data, and by March of this year, I presented it at the 8th World Congress on Brain Injury, and that's what I'm going to show you in just a minute. 3 days after that presentation, on March 15th, Dr. William Duncan, Mr. Hoffman, and Colonel Jim Wright met with the Army Surgeon General, and we were told two things. Number one, my data was a placebo effect, and number two, I would never get the congressional appropriation through the Army. And we're waiting to see if that's going to happen. Like I said, I just resubmitted this in June. The final part of this is that in May, the Navy Surgeon General appeared before a congressional committee, and when asked about the reported scientific results of the pilot trial I've been conducting, the Navy Surgeon General stated that there is an awful lot of fraud out there, intimating that essentially this study and the results are fraud. Now, I have to say, this study is done with independent participants, my colleagues. The neuropsychologist, who is an independent neuropsychologist, and the imaging data you're going to see is done by the chairman of radiology from the University of North Dakota School of Medicine. So to present fraudulent data, there are going to have to be a lot of dishonest people in on this study, we're gonna proceed to this in just a second. The last thing I want to tell you is that the National Brain Injury Rescue and Rehabilitation Project has been launched, and we're underway. We are still seeking funding. We have a bill before Congress right now to require treatment of traumatic brain injury and PTSD should subjects, patients show improvement on any treatment under an IRB-approved protocol. We'll know by August if this is going to become law. To date, I have treated approximately 110 chronic brain injured patients. Approximately 70 of them are TBI of non-blast cause. The other 40 are military veterans with blast-induced traumatic brain injury. 28 of them are in this study, and the results are very, very consistent. So let me show you the results, and we'll see what your appreciation of this data is.